Hello all, welcome to my channel Vet Lecture. Today we will discuss multiple choice questions on veterinary pathology. Question number first. Amyloid occurs in the body as a result of option A immune complex, option B antigen, option C antibody, option D starch. The right answer is option A, that is immune complex. Amyloids occurs in the body as a result of immune complex. Actually, amyloidosis is a rare disease that occurs when an abnormal protein, that is amyloid, build up in organ and interfere with normal functions. These amyloids are formed by aggregations of beta amyloid peptide that is generated by cleavage of larger protein, and this amyloid can be stained with dye that is Congo red. Okay. Questions number 2. Pili concretions are made up of option A plant, option B polythene, option C hair, option D desquamated cells. The right answer is option C, that is hair. Pili concretions are actually made up of hair. The word pili itself stands for hair. Questions number 3. Primary granules of neutrophils contain option A lactoferrin, option B lysozyme, option C myeloperoxidase, option D lipase. The right answer is option C, that is myeloperoxidase. Let's see that the neutrophils contain three distinct types of granule. First is primary or azurophilic granules, which contain potent hydrolytic enzymes, example elastase and myeloperoxidase, while secondary or specific granules, it contain high level of iron binding protein, that is lactoferrin, or tertiary or gelatinous granules which contain matrix metalloproteinases. Okay. And if we see that basophil, it contains two types of granules only, that's primary of azurophilic granules which contain same acid hydrolysis and other enzyme, and specific granules which include heparin, histamine, leukotriene and lysosome. But in case of eosinophil, it lacks primary granules. It contain only a large amount of secondary granules. The secondary granules of eosinophils are that eosinophil peroxidase, major basic protein, eosinophil cationic protein, extra. Okay. Questions number 4. The principal constituents of purulent exudate, option A serum, option B plasma, option C neutrophil, option D eosinophil. The right answer is option C, that is neutrophil. If we see that purulent exudate is thick and opaque exudate that is stained yellow or green or brown in color. It is an inflammatory exudate with a high concentration of leukocytes, mainly neutrophil, and it also contain dead cell matter, inflammatory molecules like cytokine, lysozymes, extra. Okay. Questions number 5. Hyperstatic congestion is most common in option A lungs, option B liver, option C kidney, option D intestine. The right answer is option A, that is lung. Hypostatic congestion is that pooling of blood in capillaries and vein, actually in the dependent part of that body due to effect of a gravity. It is mainly occurs 1 to 2 hours after that and becomes stable after 12 hours, and it is more common in dependent part like lungs and kidney. Okay. Questions number 6. Brown induration of lungs is common in option A acute general passive hyperemia, option B acute local passive hyperemia, option C chronic general passive hyperemia, or option D chronic local passive hyperemia. The right answer is option C, that is chronic general passive hyperemia. Okay, passive hyperemia, also known as congestions, according to its distribution, it is classified into two types, that's local and generalized or systemic. And further, according on onset and durations, it may be of also two types, that's acute and chronic. If that acute local congestions is characterized by sudden occurring complete venous obstructions, mainly occur due to like ligations of vein, thrombosis, mechanical pressure, which is mainly seen in strangulated hernia, volvulus, into suction case. And in case of that, when there is a collateral circulation is present, no harm will occur. But if that collateral circulation is absent, that local venous congestions, edema, cyanosis occurs. Second is chronic local congestions, which is mainly characterized by gradual occurrence, incomplete venous congestions, mainly caused by venous compressions, by tumor, enlarged lymph node, liver cirrhosis, portal venous congestions, extra. And acute general congestions occurs in acute heart failure. Chronic general congestions occurs due to valve stenosis. And there is two terms. First is nutmeg liver and indurations of lung. Nutmeg liver is a condition which is seen in liver during when there is a right side heart failure or tricuspid valve stenosis, while intrusions of lungs is a condition which is seen when there is a left side heart failure and bicuspid or mitral valve stenosis. Okay. Questions number Questions number 7. Proud flesh refer to that option A, inadequate formation of a granulation tissue. Option B, accumulation of excessive granulation tissue. Option C, accumulation of excessive collagen, or option D, none. The right answer is option B, that is accumulation of excessive granulation tissue. Since proud flesh is a granulation tissue, is formed when that excessive amount of new tissue is produced when a wound is about to healing. Since proud flesh usually occurs when that skin start to heal itself, that at first that's granulation tissue form over the wound, and this granulation tissue is covered by the skin and forming that proud flesh. Okay. Question number 8. Partial loss of epithelium on skin or mucous membrane is known as option A, abrasion, option B, erosion, option C, laceration, option D, contusion. The right answer is option B, that is erosion. Partial loss of epithelium on skin or mucous membrane term as erosion, while abrasion is that wound when then only a superficial layer, that is epidermis of skin, is damaged. Since that lacerated or avulsion is a type of wound which is mainly characterized by tone and uneven edges caused particularly by rough and blunt object. And if we see that contusion is a wound which is produced by continuous striking of a blunt object that result in a damage in that subcut tissue without breaking the continuity of that skin surface. And if we see that contusion, it is classified into three types. First is first degree contusions, second degree contusions, and third degree contusions. In case of that first degree contusions or bruises, there's a rupture of capillary vessels only under that skin and subcut tissue, and formation of bluish or purplish discoloration of the skin. And if we see that second degree contusions, there's a ruptures of larger vessels and lead to the formation of hematoma. And in case of third degree contusion, there's a considerable destruction of a tissue which may result in gangrene as well. And if we see that punctured wound is mainly characterized by a wound which is caused by sharp pointed object. Example, a nail, mainly characterized by narrow opening and deep in nature. Okay. And if we see that penetrating wood is also like punctured wood, deep in natures, but it would communicate with that normal body cavities like abdomen, thorax, trachea, extra. And if we see that perforated wound is mainly characterized by there's a presence of two opening. First is for entrance and second is for exit. Okay. And if we see that gunshot wound is produced by various type of firearms, and where that the point of entrance of bullet is marked by small opening on the skin. Okay. Questions number 9. The following are functions as endogenous pyrogen except option A, interleukin first, option B, interleukin 6, option C, tumor necrotic factor alpha, or option D, interleukin 2. The right answer is option D, that is interleukin 2. Since exogenous pyrogens are the substance which is originate outside the body and which are capable of inducing interleukin, while endogenous pyrogens are the substance which originate inside the body and capable of inducing a fever by acting on hypothalamus thermoregulatory center. Example of endogenous pyrogens includes interleukin first, interleukin 6, tumor necrotic factor, and interferon. Okay. Questions number 10. Major basic protein mainly presents in the option A, neutrophil, option B, eosinophil, option C, basophil, or option D, macrophages. The right answer is option B, that is eosinophil. Major basic protein are mainly presents in a eosinophil acidophil, which is stained red or pink with acidic dye, that is eosin. Okay. Questions number 11. Triple response in the inflammation was described by option A, Sir Thomas Lewis, option B, Julius Cohnheim, option C, Ali Metchnikoff, option D, Claudius Galen. The right answer is option A, that is Sir Thomas Lewis. Since the triple response of inflammations is given by Sir Thomas Lewis, It is a cutaneous response that occurs when there is a firm stroking of that skin. At first, there is a productions of that initial red line, which is followed by a flare around that line, and then finally forming a wheal. Okay, and while Julius Friedrich Cohnheim, who is also that pioneer of experimental pathology, um, describe about the morbid changes that occurs in animal tissue affected by inflammations and tuberculosis and other disease state. He also did research into the finding of causes of inflammations too. Okay, Eli Metchnikov, which is a Russian scientist who was the first to discover about phagocytosis, that's a cell-mediated immune response to foreign matter, while Claudius Galen discover about the arteries are the one which carry blood, but he did not discover about circulations. And if we see that Rudolf Virchow, who is known as father of modern pathology, mainly gave his theory that cells are arises from the pre-existing cells. Okay. Questions number 12. Most chemical mediator of the inflammation cause an increase in vascular permeability only in option A, arterioles, options B, capillary, option C, venules, option D, all. The right answer is option C, that is venule. Most chemical mediator of that inflammations causes an increase in vascular permeability only in venules. If we see that chemical mediator of inflammations include vasoactive amines such as histamines and serotonin, peptide, for example, bradykinin, eicosanoids, that is thromboxane, leukotrienes, and prostaglandin. Okay. Questions number 13. Itching effect in the inflammation is produced by option A, bradykinin, option B, histamine, option C, prostaglandin, option D, leukotriene. The right answer is option B, that is histamine. Itching effect of inflammation is produced by histamine. And let's see the description of different type of chemical mediator of inflammations are as follow. First is bradykinin. Bradykinin is one of the potent inflammatory mediator, and it's activate a signaling pathway which result in increased vascular permeability, vasodilations, hypotension, pain, and fever. And second chemical mediator is histamine. It is also a potent inflammatory mediator and is mainly commonly associated with allergic reactions and promote vascular and tissue changes, and also poses high chemoattractant activity. Third chemical mediator is prostaglandin, which play a key role in generation of inflammatory response, contribute to development of cardinal signs of acute inflammations, that is rubor, calor, loss of functions, pain, and soiling extra. And fourth chemical mediated is leukotrienes, leukotrienes B4. Its main function is to promote inflammations by activating the productions of inflammatory cells, just like neutrophils and cytokines molecules extra. Questions number 14. Dash help in the proper folding of the protein in their transport across the endoplasmic reticulum and Golgi complex. Option A, chaperones. Option B, heat shock protein. Option C, both A and B. Option D, C-reactive protein. The right answer is option C, that is both A and B. Chaperone, which is also known as heat shock proteins, which helps in the proper folding of that protein in the transport across endoplasmic reticulum and Golgi complex. Since chaperones is not other than it's a special type of group of protein which is responsible for ensuring that the various processes like translocations, degradations, and folding of proteins are carried out properly at all time. That protein synthesis starts from that when the DNA of a gene is transferred to mRNA through that transcription process, and this mRNA undergo translations process to produce protein. Although that the synthesis of a polypeptide does not guarantee the production of functional protein, for that the production of functional protein, that polypeptide must be fold into correct three-dimensional conformations without undergoing aggregations or degradations. Okay, although that amino acids sequence of mRNA polypeptide chain provide all informations that protein need to assure that the correct three-dimensional configurations, but still there is a need of that interventions of other protein to ensure proper folding within a cells, and this other protein is that chaperones, which aids in that proper folding of the protein by facilitating their assembly without being part of that resulting complex. Okay. Questions number 15. Free radicals cause cell injury by option A, lipid peroxidation of a membrane, option B, cross linkage of a protein, option C, DNA fragmentation, or option D, all. The right answer is option D, that is all. Free radicals are that chemical species which having a single unpaired electron in their outermost orbit. They readily react with that organic or inorganic chemicals and attack and degrade nucleus and membrane. And if we see that generation of the free radical are generated either by cellular metabolisms, that is from cell oxidation reductions reactions, example oxidative phosphorylations. Second is enzymatic metabolisms of exogenous chemicals, which produce intermediate metabolites, which are highly reactive free radicals. Third, by ionization radiations, which hydrolyze water into hydroxyls and hydrogen ion. And the fourth, but not last, that is divalent metals, also known as transitional metals like coppers and irons, which either accept or donate free electrons during intracellular reactions and catalyze free radicals formations. Okay, here are some important free radicals like superoxides, anion, hydroxyls, ions, hydrogen peroxides. Since hydrogen peroxide is not itself a free radical, but it generates a free radical hydroxyl ion from reactions with the copper or ferrous ion. Okay, and free radical cause cell injury either by lipid peroxidations of the membrane, cross linkage of the protein, DNA fragmentations, extra. And if we see that protections mechanism of cells that include storage and transport protein like ceruloplasmin, transferrin, lactoferrin, since that iron and copper, which catalyze the formation of a free radicals, and this are minimized by bound with storage and transport protein. And okay, and second is that antioxidant, for example, vitamin E, glutathione, vitamin A, ascorbic acid, which block the formation of free radicals and also that scavenge them. And third and not last, that's enzymes, glutathione, peroxidase, superoxide dismutase, catalase, which are also that free radical scavenger. Okay. Um, Questions number 16. Inflammatory exudate has the property of option A, protein above 3%, option B, thick consistency, option C, specific gravity above 1.02, or option D, all. The right answer is option D, that is all. Okay, let's see the difference between a transudate and exudate fluid. Since the transudate is a type of pleural effusions in which that fluid is pushed through that capillary due to that high pressure within that capillary. And in case of exudate, it is a type of pleural effusions in which that fluid leak around the cells of capillaries, mainly caused by that inflammations. Okay, transudates occurs due to either that there is a hydrostatic pressures in capillaries is high, or that osmotic pressures of capillaries is becoming low. Okay, while exudates occur due to that increasing the permeability of that vascular capillaries because of a chemical mediator of inflammations. Okay, and in case of transudate, results in a filtrate of that clear or pale yellow color fluid with low protein content and low cells content, while exudate is that cloudy or bloody fluid with high protein content and high cell content. Okay, common cause of the transudate is like congestive heart failure, chronic kidney diseases, protein losing enteropathy, nephrotic syndrome, hepatic cirrhosis, extra. And common cause of exudate is like infections, malignancy, pulmonary embolisms, autoimmune disease, extra. And if we see that specific gravity of transudate fluid is less than 1.015, and specific gravity of exudate fluid is one greater than 1.015, and protein content of transudate is less than 3 gram per dl, and protein content of exudate is high, that is greater than 3 gram per dl. And LDH concentrations in case of a transudate is less than 0.6, and LDH concentration in exudate is greater than 0.6. Okay. Questions number 17. The inflammatory cells seen in acute inflammation is option A, neutrophil, option B, lymphocyte, option C, plasma cell, or option D, macrophages. The right answer is option A, that is neutrophil. Okay, and if we see, let's see the difference between acute and chronic inflammations. Okay, acute, the causative agents of acute inflammations, either pathogens, injure tissue, and the causative agents of chronic inflammation is persistent acute inflammations due to like non-degradable pathogens, persistent foreign bodies, or autoimmune reactions. Okay, and if we see that's major cells involved in case of acute inflammations is neutrophil, mononuclear cells, that is monocytes and macrophages. And in case of chronic inflammation, it's mononuclear cells, that's monocytes, macrophages, lymphocytes, plasma cells, and fibroblasts. Okay. Primary mediator of acute inflammations are vasoactive amines, eicosanoids. Okay. And primary mediator of chronic inflammation is interferon gamma and other cytokines, growth factors, reactive oxygen species, hydrolytic enzymes, extra. Onset of acute inflammation is immediate, therefore it is called acute inflammations. And onset of chronic inflammation is delayed, and acute inflammations last for only few days, while chronic inflammations last for many months or years. Okay. And if we see that the outcome of that acute inflammation, either that acute inflammation get resolved, or sometimes that acute inflammation lead to abscess formations, and sometimes that acute inflammations lead to that toward that chronic inflammations. Okay. And that outcome of chronic inflammation is tissue destructions and healing, since healing and the destructions occurs concurrent in case of chronic inflammations. Questions number 18. Lymphocytes predominant seen in the inflammatory exudate in conditions like option A, viral infections, option B, bacterial infections, option C, parasitic infections, option D, none. The right answer is option A, that's viral infections. Although neutrophil is the predominant cells which is seen in inflammatory exudate of all conditions, but lymphocytes are predominant in inflammatory exudate of case of viral infections. Okay. Questions number 19. Benign tumor of smooth muscles is known as option A, rhabdomyoma, options B, leiomyoma, option C, leiomyosarcoma, option D, none. The right answer is option B, that is leiomyoma. That benign tumor of smooth muscles is known as leiomyoma. The malignant tumor of smooth muscles is known as leiomyosarcoma. Since the suffix sarcoma stands for malignant and oma stand for benign. Okay. Benign tumor of stated muscles is known as rhabdomyoma. Benign malignant tumor of stated muscles is known as rhabdomyosarcoma. Okay. And if we see that benign tumor of cardiac muscles is myxoma, and malignant tumor of cardiac muscles is cardiac sarcoma. Okay. Basal cells carcinoma, also known as rodent ulcer. Okay. Questions number 20. Cytological methods commonly used in diagnosis of tumor is option A, hematoxylin and eosin method, option B, Papanicolaou, option C, both A and B, option D, none. The right answer is option C, that is both A and B. Cytological methods which commonly used in diagnosis of tumor is both, that is hematoxylin and eosin method, and Papanicolaou test, that is PAP test. Okay. We already discussed about hematoxylin and eosin methods in a previous video. Since hematoxylin and eosin method is a staining methods where hematoxylin stain a nuclear content of a cells and eosin stain cytoplasmic content of a cells, and which is helps to seen about that structures and structural change in that nucleus and the cytoplasms, and help in the diagnosis of a tumor. While Papinicolaou test, that is also known as a PAP test, it is a procedures in which a small brush is used to gently remove the cells from that surface of the cervix and that area around it, so that can be a check under that microscope for cervical cancer or the cell changes that may be lead to cervical cancers. Okay. Questions number 21. Prostate cancer results in elevated level of blood. Option A, alkaline phosphatase. Option B, acid phosphatase. Option C, ALT. Option D, AST. The right answer is option B, that is acid phosphatase. Prostate cancer results in elevated level of acid phosphatase enzymes in blood. Okay, let's see some other facts related to tumor. The usual organ or site for the metastasis for the primary tumor is lungs, actually lungs. Chondromas are the benign tumors of cartilage. Melanoma, which is a type of benign skin cancer, is most commonly seen in case of old dog. And horn cancer that affecting mainly aged cattle is a type of squamous cells carcinoma. Sertoli cells tumor in male dog, which is a feminizing tumor, while seminoma is a musculizing tumor in female animal. Tumor that arising from serosal epitheliums are called as mesothelioma. Okay. Questions number 22. The cause which predispose to the occurrence of disease is called as option A, intrinsic cause, option B, predisposing cause, option C, extrinsic cause, option D, both A and B. The right answer is option B, that is predisposing cause. The cause which predispose to the occurrence of disease is called as predisposing cause. Okay. The agents which is responsible for the disease primarily comes outside the body is called extrinsic factor, while the agent which is responsible for disease primarily comes inside the body is called as intrinsic factor. Okay. Questions number 23. Septic bacteria in the blood is known as option A septicemia, option B toxemia, option C pyemia, option D hyperemia. The right answer is option A, that is septicemia. Septic bacteria in the blood, that term is septicemia. Emia is a term which mainly refer that presence in a blood. Okay. If the toxin in the blood, that's conditions is called as toxemia. If the pus in the blood, that condition is called as pyemia. Okay. An excess of the blood in the vessels supplying an organ or other part of the body, such condition is known as hyperemia. Okay. Questions number 24. Light blue amorphous region in the cytoplasm of toxin neutrophil are known as option A Russell body, option B Joule body, option C Mallory body, option D basic protein. The right answer is option B, that is Joule body. Light blue amorphous region in the cytoplasm of toxin neutrophils, that is known as Joule body. Since Russell's body is a globular cytoplasmic inclusion, which is mainly composed of immunoglobulin that accumulated mainly in plasma cells. Okay, while cytoplasmic eosinophilic inclusions, which is mainly present in hepatocytes and associated with ballooning and inflammations, mainly seen in liver cirrhosis. Uh, okay, okay, and eosinophil granules protein, that is known as major basic protein. Okay. Questions number 25. Okay. Self-assembling extracellular system of a protein which is present in inactive form in plasma and body fluid is called as option A C-reactive protein, option B fibrinogen, option C complement, option D heptaglobulin. The right answer is option C, that is complement. Self-assembling extracellular system of a protein which is present in inactive form in case of plasma and body fluid is called as complement. And C-reactive protein is the protein which is made by liver and which is sent into the blood streams in response of inflammations. In normal conditions, it is low in blood. Okay. While heptaglobulin is a protein that is encoded by heptaglobin gene and which has a high affinity to that free hemoglobin and most often used to diagnose like hemolytic anemia, and exceeding heptaglobin indicate the sign of acute rheumatic fever, ulcerative colitis or a heart attack. Okay. Questions number 26. Pathological epithelial hyaline is seen in prostate gland called as option A hyperkeratosis, option B corpora amylacia, option C Zenker degenerations, option D white muscles disease. The right answer is option C, option B, that is corpora amylacia. Corpora amylacia is a general term for that small hyaline mass which is present in a prostate gland, nervous systems, lungs, and sometimes in other organs of the body. While hyperkeratosis are conditions where there is a marked by thickening of that outer layer of the skin made up of that keratin, and Jenker degeneration is a severe glacier waxy hyaline degenerations or necrosis of skeletal muscles, which is mainly seen in acute infectious disease. And while white muscles disease, also known as nutritional myopathy, which is mainly seen in young calf due to the deficiency of vitamin E or selenium. And while mucoid degenerations may be seen in condition like myxoma, myxedemia, malnutrition, extra. Okay. Questions number 27. The tissue changes that occurs on excessive absorptions of heat by the skin known as option A scald, option B burns, option C heat stroke, option D sunstroke. The right answer is option D, that is sunstroke. The tissue changes that occurs on excessive absorptions of heat by the skin, that is known as sunstroke. While heat stroke is a condition when a core body temperature goes beyond greater than 104 degree Fahrenheit, with complications involving like CNS that occurs after exposure to high temperature, while scald is a burn by moist heat or steam. Okay. Questions number 28. Pigment is referred as aging pigment. Option A melanin, option B lipofuscin, option C hemosiderin, option D porphyrin. The right answer is option B, that is lipofuscin. Lipofuscin is referred as aging pigment. Lipofuscin depositions is an important marker that indicate that cells suffer from free radical injury. Okay. Questions number 29. A blue line is seen at the junction of the teeth and a gum in case of option A, mercury toxicity, option B, lead poisoning, option C, arsenic poisoning, option D, fluoride toxicity. The right answer is option B, that is lead poisoning. A blue line is seen at the junction of the teeth and gum in case of lead toxicity. Okay. Questions number 30. Biphasic type of Vandenberg reaction is seen in option A, hemolytic jaundice, option B, toxic jaundice, option C, obstructive jaundice, option D, all. The right answer is option B, that is toxic jaundice. Biphasic type of Vandenberg reactions is seen in case of toxic jaundice. Okay. Vandenberg reaction is a specific type of reactions which is used to identify the increased serum bilirubin level. And if we see that normal values of that this bilirubin level is that total bilirubin concentration is 0.2 to 1 mg per dl. Direct or conjugated bilirubin is that 0.1 to 0.4 mg per dl. Indirect or unconjugated bilirubin is 0.2 to 0.7 mg per dl. Okay. And Vandenberg reagents mainly is nothing, is a mixture of that equal volume of sulfonilic acid in dilute HCl and sodium nitrite. Okay. And principles which involve for Vandenberg reaction is that when diazotides sulfonilic acid is mixed with that bilirubin, that it form purple color complex which is known as azobilirubin. Okay. And after the reactions, we see three types of response of Vandenberg reactions. First is direct positive. When the sample are treated with that Vandenberg reagents, that purple color come within 30 seconds, then such type of reaction is called direct positive, which indicate that the person's suffering from post-hepatic or obstructive jaundice. That's conjugated bilirubin is high at that time. Okay. Indirect positive, when a sample treated with that Vandenberg reagents, purple color comes only after additions of alcohol called indirect positive, indicated person suffering from hemolytic jaundice or pre-hepatic jaundice at the time that unconjugated bilirubin is high. Or biphasic reaction is when a sample treated with Vandenberg reagents, initially purple color is developed but intensity of color is increased with additions of alcohol only. Such type of reaction is called biphasic Vandenberg reactions, indicated person suffering from toxic or hepatic jaundice. Both unconjugated and conjugated bilirubin is high at the tap test. Okay.